Good morning, students. I am Dr. K. Pushpam, Assistant Professor in Sociology. Today we are discussing about the topic of alcoholism. Alcoholism is a chronic relapsing disease characterized by denial and inability to discontinue its use despite knowing its adverse consequences. A person is considered to suffer from chronic alcoholism if his use of alcohol is up to such extent that it interferes with successful physical and social functioning. The next is a definition of alcoholism. The National Council on Alcohol and Drug Dependency and the American Society of Addiction Medicine define alcoholism as a primary chronic disease characterized by impaired control over drinking, preoccupations with the drug alcohol, use of alcohol despite adverse consequences and distortions in thinking. Then DSM-IV defines alcohol abuse as repeated use despite recurrent adverse consequences. So the alcoholism is a repeated use of the particular beverages or alcohol substance. Then it further defines alcohol dependence as alcohol abuse combined with tolerance, withdrawal, and an uncontrollable drive to drink. Then next is we are known about the use and then only we are understanding the abuse. So first one is use refers to simple use of a substance. An individual who drinks any alcoholic beverage is using alcohol. Moderate use is defined as no more than 2 alcoholic beverages per day for men and no more than 1 alcoholic beverage per day for women. Abuse is often used to refer to the illegal use of any substance, use of prescription medication in excess of the prescribed dosage, or use of a prescription during without a prescription, and sometimes refers to use that results in a long-term health problems. So the abuse is always we are continuing or oftenly using the particular substance beyond that the prescribed dosage. The next one is cause and risk factors of the alcoholism. Genetic factors. It runs in families. Children of alcoholics consume 4 times more than the children of non-alcoholics. So, if father is alcoholic, children are having greater risk. The next one is psychological factor. Poor stress management skills, loneliness, desire to escape from reality, a sense of adventure, pleasure seeking, emotionally immature, and need for praise and appreciation. The next one is low frustration tolerance, feelings of inadequacy, psychological trauma during childhood is disrupt parent-child relationship. So without any relationship between the parent and children, that is also going to the psychological trauma. So that kind of behavior or that kind of psychological feeling leads to the alcoholism. So then next one is inferiority, low self-esteem, poor impulse control. So without the control mechanism or control attitude for the alcoholism, taking alcoholism. So that is also one of the way for alcoholism. The next one is disorder like depression, anxiety, phobia are prone to consume as an escape. The next one is personality disorder. Persons who have horse super ego and who are self-puncture tend to alcoholists to diminish their stress. So person who thinking we are taking the alcoholism, due to the alcoholism taken we are reduce our stress. Childhood history of antisocial personality also disorder. So the antisocial personality even we are affecting from the childhood period, that behavior also leading to the taken alcoholism. Then common in cyclothemic personality. Then next moving on social factors. Overcrowding, influence of bad company, cinemas and literatures. Then the overcrowding means the too much of persons among the family or from the society. Due to the crowding we are facing the many problems in the society, that also leading to the taken alcoholism. The next one is peer pressure, urbanization, religious reasons and unemployment. So these are the reasons also leading or pathways for the taking alcoholism. Poor social supports fashion, a sign of modernity, social inadequacy, and isolations. So we are don't take any kind of social support from the family members or our societal members. The lacking support that also create or that also tendency making for the alcoholism. Some settings as colleges and military settings where alcohol is considered as status symbol. So some of the social institutions or some of the military institutions, that is institutions taking the alcoholism considered as a status. That time also the particular persons are taking alcoholism to forget miseries and problems of life. Then unhealthy environment, sudden loss in property or closed ones. Then parental disharmony. So without a parental community among the family members, that is the lead to as a children or as a adult men or women taking the alcoholism among the family members. The next one is occupational behaviors. Heavy vehicle drivers, laborers, manual workers, physical exhaustion or hard physical labor. Under these kind of workers or laborers are taking the alcoholism because taken alcoholism, that is reduce our stress or the pain of the physical way. Next one is economic causes. The economic causes also involved for the alcoholism. Poverty, unemployment, professions like poets, painters, waiters, journalists, commercial musicians, reporters are at greater risk. So these are the backgrounds. The economic causes are influenced for the alcoholism taken. Then next one is other causes for marital disharmony. So marital disharmony, as a persons or as a family members, we don't have any kind of harmony among the family members or a marital bond or marital relationship. That relationship also leading to the taking alcoholism. The next one is easy availability, then free time and boredom and loneliness. So free time, if you have a free time, that time we are spending the other person, that persons are influenced for the taking alcoholism and boredom and loneliness. These are the causes are influenced for the drug alcoholism. The next one is drug addiction. This remaining part we can see the next class. Okay, thank you.